So what does the future hold for you?
Well, obviously, I'm still anxious about the future with cancer. I think I've given it my best shot with the treatment I've had so far. I don't think the fear will ever go away. I don't think it ever does. I think if a cancer patient ever said that, they wouldn't really be revealing truly what they felt, because, you know, it's like a little seed, and it doesn't go away. It's, you know, a little voice in the darkness every now and then that expresses its fear for you. And because of that, I've got involved more now with hopefully wanting to volunteer with the psycho-oncology department, with helping to set up some probably support groups or drop-in areas for patients to befriend others, and just, you know, nothing too huge yet. It's in its infancy. I really feel that that was a very important part of my treatment, and I feel that I wouldn't be in the place that I am now mentally, emotionally, as strong as I am, if I hadn't had that support. So I now want to go and support others myself in that way, with whatever way I can, really, either by my experience, by just listening, or perhaps by, you know, letting somebody offload who doesn't feel that they can offload in a medical or a home environment. For all patients, not just really even for just patients who have had breast cancer, although that is the one obviously personally I've had the experience of, or even in a more distant capacity, not in a one-to-one with the patient, to try and raise the profile of what psycho-oncology does for people undergoing cancer, and, you know, to get the referral rate higher, or to be able to manage that better, and to get funding increased for that service, because I feel it's a very important part of the cancer process.
And maybe that's a message that people can take away, not just for this region, but other areas.
Oh yes, nationally, I think that should be in place anywhere where medically cancer treatment is being provided, because you wouldn't, you know, you wouldn't have an operation and not have medical support there. For example, if you were having a breast operation, the services would be providing breast care support and areas around that. So why not support provided mentally and emotionally for that operation, for the breast, and around that. And the other thing as well is, of course, there is one other thing that I hadn't mentioned before, and that's important, I feel, specifically to breast cancer. And it may be involving other cancers as well, which I have no knowledge of. And that is when you have breast cancer and you are given chemotherapy and your hormones are, you know, messed about with because of the treatment itself, those hormonal problems manifest themselves as well in people, which don't help your mental state and your emotional state, with mood swings and things that you're not expecting. Again, nobody ever sat down as part of the breast cancer treatment process and spoke to myself or a few of the other ladies I've spoken to about hormonally the role that the chemotherapy will play, how it will affect your hormones. They said it would, and you would get menopausal symptoms, but nobody ever said, and if you're struggling with those menopausal symptoms, as well as probably physical things as well about your looks cosmetically, here is psychological support for that. There was no mention of that either. And I know that other ladies have really struggled with that. So to me, yes, you know, make sure there's medical support there, which there is around these big treatments and these operations, but further out from that core, that centre core of the medical treatment, it's essential that you have the emotional and mental support, which I got, thankfully, from psycho-oncology referral.
That's kind of